Hi, everyone. I am Dr. Jordan Dieterle from Pinnacle Chiropractic. Thank you so much for tuning in tonight to hear a little bit more about prenatal care with chiropractic and why it is so important for your pregnancy. So just a little bit about me to kind of explain why I am here talking to you about this. I graduated from Palmer College of Chiropractic, and after graduation, I already knew that I really wanted to do prenatal work, pediatric work, and also animals. And right after graduation, I started really kind of diving head in. I had already started my seminars for the ICPA, which is the International Chiropractic-Pediatric Association. And there's about 14 seminars. So I was about halfway through when I was done with school. I had already gotten my Webster certification, which I will explain during this webinar. And I wanted to finish my seminars and get my full certification. So I completed that certification in 2019. And I also completed my animal certification in 2018. And those are just my really big passions in life. I got into chiropractic because of my horse, and it ended up changing my life, my health, and made me want to become a chiropractor. And based on my experience with birth, I guess my experience is my birth, but my mom had a very traumatic experience. She had a very hard time getting pregnant. And so growing up, I had heard that story so many times. She wanted 6 kids, said she'd settle for 4 girls, and then she just got me. So I heard that so much growing up and knew that playing a part in some kind of role in pregnancy, whether it was an OBGYN or some pediatrician even, I knew I loved that, and I really wanted to take that on as something. And being a chiropractor for children and pregnant moms and animals has been the dream job. So those are all my certifications. I definitely have gone a little bit further, a step further to really make sure I know what I'm talking about and to just get as much knowledge and information as I can to always share with my patients. So tonight I'm going to tell you about prenatal chiropractic. And after I'm done talking, a dear friend and patient, Jess, is going to come on and share her story with chiropractic during her pregnancy with her daughter. And then at the end of this video, there's going to be a deal. So if you do watch this webinar tonight, and you're pregnant or trying to get pregnant, or maybe you had a baby and then now have realized how important it is for infants too, there will be a deal at the end that you can call our office and tell them that you watch this webinar, and that will be offered for you. So without further ado, I'm gonna go through a PowerPoint with you and talk about prenatal care for prenatal patients. So you might be thinking, why does anyone need chiropractic care? What is chiropractic care exactly? So this is a brief overview, but chiropractic care is a really safe and non-invasive approach to healthcare. We really are looking at the entire body and seeing what is going on that's causing that to happen. So instead of looking at a symptom, say depression, we are looking back at what could cause that, what in the body is going on. Are there things that aren't level? Is it a imbalance within the body in terms of your spine, actually? And those nerves aren't functioning properly. The whole point of chiropractic is we really want your brain to tell your body what to do and then understand the relayed messages back if that's happening. So we want there to be zero communication error between the brain and the body and the brain. The issue is we live in a very, very stressed out world. And especially this year, we can probably all agree that no one has been without stress. But when you are under stress, whether it's physical, chemical, or emotional stress, that's going to cause issues within your spine and decrease motion, which is going to cause a misalignment and therefore lead to dysfunction within your body. So that dysfunction can be through any of your tissue, organs, glands, nerves, and all of those things are how our brain talks to us. So if there's a dysfunction in any of those areas, we're now looking at huge systems within the body kind of having to compromise in terms of how they're working, how they're functioning, and we'll never be at our optimal level. So you might think chiropractors just touch the back and we're only back doctors, pain doctors, but really your nervous system is what we're focusing on. And that nervous system is what controls your respiratory system, your endocrine system, your reproductive system. There's just so many things that are responsible because of the spine and the motion in that spine. So being a chiropractor, we're really just trying to allow your body to work optimally, allow there to be movement within the spine, and that's how adjustments help us to do that. So because of this, if you can look at all of these effects on the side of the screen, there's a lot of them that actually lead back to infertility or issues with the reproductive system. So really hard periods or PCOS, endometriosis. All of those things have a link to somewhere in the body. And so if we can start adjusting somebody before they're even pregnant, that is my favorite thing to do, because we have such a huge role on someone's ability to be the healthiest version of themselves so they get pregnant easier and they're having the best pregnancy possible. So getting adjusted before you get pregnant is my first tip. If you're already pregnant and watching this video, it's not too late. But if you are considering getting pregnant at any point in the future, the cycle of your egg is 120 days. So 4 months before you even start trying to get pregnant, we can help make your body and those eggs as healthy as humanly possible, because of course, how healthy your eggs are, how healthy the sperm is going to affect how healthy the embryo and baby are. So at our office at Pinnacle, you have maybe seen some posts, maybe heard something, but our office really deals primarily with kids. We are 75% pediatric, and then the rest of those patients make up pregnant moms and postnatal moms, as well as the dads and other siblings too. So our office is really known for dealing with nervous systems that are stuck in fight or flight. So this can look a huge variety of things, but it can look like anxiety. It can look like ADHD. It can look like children who are chronic bedwetters. It can look like children who have speech delays or maybe toe walking. All of these things that sometimes lead to other diagnoses are something that we really specialize on in our office and really, really focus on. So we are always looking at that nervous system, and in doing so, we're helping the nervous system and the brain and the body to calm down, to communicate better, to take all that tone and their tension and to release that for them. There's a lot of science things I could talk about in the brain and the prefrontal cortex, and all these kids are stuck in their limbic system, which is their emotional system, and that's why they're having all of these issues. But the basic thing to know is that we help a variety of kids once they're age 2, 3, 7, 15, struggling with these things. And we are very busy at our office. If you've driven by and seen the kids in the front playing or seen how many pictures we post of children. But the reason we're so busy is that right now there are 1 in 59 children being diagnosed with autism, and 1 in 13 children are diagnosed with allergies. I think that's actually much lower than that now, as well as 1 in 12 children being diagnosed with asthma. 1 in 10 are diagnosed with ADHD, and 1 in 6 will experience some sensory symptoms. And that can be a wide variety of things again. So this talk is about pregnancy, of course, and this huge miracle that we're seeing in this photo. But all of those things that we see in our office on a daily basis, a lot of that comes back to pregnancy and the stress that we experience as moms during pregnancy and trying to get pregnant, and really especially during labor and delivery. So that being said, here's some more stats for you. 1 in 8 couples actually have a really hard time becoming pregnant or sustaining a pregnancy. So if you maybe have experienced this yourself or have a friend, struggling to get pregnant is unimaginable and hard for so many parents, but it's something they deal with and have dealt with 1 to 7 times. And that is a really emotional, hard thing when you're trying to get pregnant and not able to. So if you can imagine the stress that puts on your body, and like I said, emotional stress really is equally as bad for your nervous system as physical stress. So of that, 20 known pregnancies end in a miscarriage. And that's of the pregnancies that we know for a fact are pregnant. A lot of times those miscarriages end up happening before 6 weeks, so before moms are even quite sure if they are pregnant. And this is the craziest part. The US is actually ranked 61st in maternal health care. So of all of the developed countries in the world, the US is the most dangerous place to give birth. And, part of that, there's a lot of reasons we could talk about why. Really, no one is to blame. There's just a lot of things that we do now for convenience. Our world is very much, we love things being quick and on time and things happening right now. And if it's not immediate, we don't want it. So because of that, there's definitely been an increase of inductions and C-sections. So that could be part of it. And of some more stats are that 20 to 40% of births are induced. there's a wide variety of why a delivery would be induced, but lots of studies show that actually inducing can cause other things. So it increases the likelihood of a C-section by 67% and NICU stay for the baby by 64%. And 32% of births result in C-section, and only 10% of those are emergency. So C-section is the ultimate intervention in terms of intervening in a mom's pregnancy and her labor. So we can talk about vacuum extraction, forceps delivery. Of course, induction is so common, and it's something that people think is normal, but it's not normal, it's common. So it's not something that we want to strive for by any means. And then C-section is definitely the most invasive, and where we find in our office the most stressful on a baby. They are using about 60 to 80 pounds of pressure to deliver a baby by C-section. And the upper head and neck in a baby is where all of our vital nerves are, the brainstem, basically where all of the good nutrition is going and all of the communication from the brain to the body is going. And that top bone is very easily to become misaligned or to have stress on it and not move properly. So using that amount of pressure on a baby's neck to deliver them kind of starts the cascade of what we call a perfect storm in our office, but the cascade of stress on a child's life that we see as a common denominator for children who do end up with asthma, allergies, sensory anxiety, and the list goes on and on. So the most important part, though, is, again, not blaming anyone. Health providers are amazing, and each health provider has their own specialty and their own role in a woman's delivery. But the best way that we can change these stats and the best way that we can not be 61st in maternal health care is to empower women and to educate moms on their options and how to have the best pregnancy, the least stress, and a really good tribe around them for when they do give birth. So here's some pictures just structurally of what is happening when you are pregnant. You can see that the spine has a lot of stress on it because of the growing belly. The hips really rotate. Those pelvic joints get very, very, very overused and have a lot of tension on them. There's a lot of ligaments and muscles that are pulling those bones in directions that they're not used to. There's a lot more weight in the front. Everything has to compromise and give in order for the baby to grow appropriately. So mom's definitely under a lot of strain, a lot of pressure, and potentially a lot of pain as well. So this was the cascade of intervention that I mentioned. You can study this. There's plenty of studies online, but once Pitocin is given, typically what happens is the mom will then want an epidural because Pitocin is Pitocin is synthetic oxytocin. So it's the unnatural form of what our bodies should have. And when you have oxytocin, that's what controls your contractions, but it does it very slowly. So it starts to excrete into the body and then it builds up and then you have a nice slant, like a growing amount, so that you go from 0 centimeters dilated to 10 over a period of time. With Pitocin, it's synthetic. So you go from 0% dilation to 100% contractions, hopefully 100% dilation as well, but it happens so fast and so hard that moms that have Pitocin and don't have an epidural, I cannot even imagine the pain because of how strong those contractions are. So typically, once Pitocin is given, an epidural then is necessary. Once an epidural is given, you have to be in a stationary position, which is not the best to deliver a baby. So if you think about gravity and think about how someone gives birth naturally without any of these drugs, they're not laying on their back with gravity not assisting them to have a baby. So once you're in a stationary position, then you're also working against some other factors. You're laying on your sacrum, which once that is shifted and your pelvis is misaligned because you're laying on your back, it's harder for baby to have a smooth transition into the world. So therefore you have weaker contractions, a much harder time pushing, which can lead to fetal distress, and then intervention is almost 2/3 of the time necessary. So that intervention can be forceps, vacuum, episiotomy for mom, and very often ends up in a C-section. So this is something that I encourage every mom to research. There are lots of places you can find really good information on this. A lot of moms can tell you their personal stories of this happening, because I see plenty of moms who've come into my office. Some of them are even medical providers themselves, and they will say, my first pregnancy, my first delivery was not what I wanted, and I want to do everything different this time. So this is something that every mom knows someone who's experienced this and may not have been happy with that outcome. So the best thing to do is to prepare. So there's a lot of things that I recommend. Finding a tribe is one of them. So maybe finding a doula, a midwife. Midwives specialize in uncomplicated births. So the majority of us should be able to have an uncomplicated, low-risk pregnancy and delivery, and that's what midwives actually specialize in. So finding, whether it's an OB that has a midwife or a birthing center, finding a doula, some prenatal yoga. If you want to look into hypnobirthing, just finding all of these things, even acupuncture, there's great results with all of these, but you need to have that preparation because birth is a very big event. So one of these things that obviously I think is very important is chiropractic care. So there are many, many reasons for why chiropractic care is so important during pregnancy, but I will start with what it increases. So it's going to increase your pelvic alignment. When we have our pelvis, it's made of your 2 ilium, your sacrum, the pubic bone is in front where they meet together. And most of us are on our feet all day, we're sitting all day. The only 2 things we really can do. And we put a lot of strain on our bodies anyhow, but that low back, the pelvis becomes very misaligned. A lot of people, it's really a struggle for them in their SI joints because of stress over time, tension over time. And so that pelvic alignment is what baby has to pass through. And so if that pelvic and the whole pelvic unit is not aligned properly, you oftentimes hear of a baby getting stuck while they're being delivered, and that can be part of that. Chiropractic care is also going to increase baby positioning. So people often hear about chiropractic turning babies that are breech. That's 100% not true. We don't do anything to the baby. We're not caring for the baby. Our whole goal is to make mom the most comfortable and to prepare mom's body in the best way we can. A really great side effect of mom's body being in the best possible position and having no stress on those ligaments and those joints is that baby naturally will be in a head down position like they should be, because that's what is best for the baby, and that's what the body knows to do if the body doesn't have the tension, the stress on it. So when a baby can be head down and be in the best position and not be so cramped, they have the ability to develop their spine and cranium without restriction. So oftentimes we'll actually see really good developed babies after their moms get adjusted during pregnancy, and they have less issues, I would say, after labor as well. And like I mentioned, oxytocin, it's one of my favorite things, that also increases during chiropractic care. So what does oxytocin do? It's going to stimulate your onset of labor. So like I said, when Pitocin, it goes from 0 to 100. Oxytocin is natural, and you get it every time you get adjusted. It secretes into your body. And so that's going to naturally start labor, and it's going to keep your contractions normal and on time and increasing at the rate they want them to. So after pregnancy and labor, it also does some good things. It's going to enhance maternal bonding. So the more oxytocin that you have in your body, the more oxytocin the baby has in their body, the more bonding that's going to happen between mom and baby. And it's also responsible for milk letdown. So another huge thing, if you're planning on breastfeeding for your baby, this is really big. And I did mention the Webster Technique. This was developed by Dr. Larry Webster, and he was a chiropractor who just had seen how many women that this helped, basically, by taking the strain off of mom and her joints and those ligaments and muscles, that moms were having better outcomes, babies were in the best position. And so he developed this technique specific that he found worked. And it's basically, the whole point is to restore balance to the sacrum. That sacrum is that triangular bone in the back there. And those SI joints are very, very, very common areas of tension, especially during pregnancy, because of how many ligaments and muscles are attached to that area. So this technique really allows baby to be in the best position. And chiropractic care, while we don't turn babies, for moms that come to us that the baby is breech, we have a very good success rate of babies allowing themselves to turn on their own. And it's between 85 and 90%, I believe, that our success rate for helping mom's body be in the best position then helps baby turn. If you were to go and say your baby's breech or transverse and you need to go the medical route and get an ACV, the success rate is only 50%. So that's much more invasive. There's many more issues that come with that. So chiropractic care is definitely the safe and non-invasive way to make sure that your body's in the best position, baby can be where they are happiest, and it's much safer. So you might think, okay, my baby is head down right now. I don't need chiropractic care. And while that's amazing and very good, there's also that preparation part of wanting your body to be in the best position when you're in labor, not just right now. And so you also don't want to have a baby that's in a great position and your pelvis be very misaligned. And so when you go to give birth, then you realize that your pelvis is misaligned and not functioning as it should, and baby's getting stuck, your contractions are stalling, and then there needs to be another intervention. So it's definitely something that any pregnant mom can do at any point in her pregnancy. It's a very safe technique, and Dr. Matt and I are both certified in the Webster Technique. So either of us can help you with this. And it's a very simple technique, but we're really focusing on that sacrum and on the round ligament and your psoas muscle to help make room so baby's not cramped. I have moms say all sorts of funny things when they get this done, but one mom told me it was like her baby went from living in a 1-bedroom apartment to a 2-bedroom apartment. And another mom told me that it was like her belly felt a part of her body again. So moms are always very, very happy when they see and feel the effects of this. And by see, this is a wonderful picture of a before and after an adjustment. So this is 8-10 minutes apart maybe. On the left is her pre-adjustment. You can see that the belly is a little bit lower and it's more pushed out. There's definitely not a great shape to the belly. It's not consistent. And on the right-hand side, after her adjustment, you can see her posture is a little bit better. You can also see that the belly is higher and lower. So there's much more space that opened up. So baby is probably doing a little happy dance in there. It's very common to feel them move after your adjustment because of how much motion they have and how much they're not feeling constrained. So it's much better for their development, much better for mom's back. So everyone wins. And then chiropractic care decreases some things too. So it does decrease pain and inflammation in the body. If you're watching this video and you're like, oh, pain is my only issue, there's so much more to this, but it does decrease pain. And that's because we're putting your body in its happy place. We're putting those joints, we're putting motion back into those joints and realigning your pelvis and your thoracic spine. When everything's growing and stretching, that there's so much tension and stress that it does decrease pain and inflammation very, very well. It can decrease morning sickness. It decreases that torsion that both mom and baby do experience. Dystocia, which is painful labor. It decreases need for intervention, which is proven. Decreases need for unnecessary drugs. And most moms' very favorite thing is that it does decrease labor time. For a first-time mom, it will decrease labor time by 24%. And that's what studies have shown. I'll show you in the next slide. And for a second-time mom or after, it can decrease labor time by 39%. So just yesterday, I had one of my favorite moms in our office, and she was telling another mom, like all our moms are this amazing tribe and all help each other, but she was kind of educating a newer patient in the office about pregnancy and chiropractic care during pregnancy. And she was saying her first birth with her daughter was 22 hours, which is a common, and that's not a crazy number to hear when I hear a lot of moms, how long they've been in labor. So 22 hours for her first labor, and did not receive chiropractic care at that time. So for her second labor, she had the second baby at home, and her labor was 6 hours total, start to finish, 6 hours. So that's a very, very big decrease in labor time. And here's a little snippet of the study showing exactly their measurements and how much of a change that labor time is. But it makes total sense if you think about it. If your body is in great alignment and your body is working as it should, everything's communicating, you have all that oxytocin built up in your body. Maybe you don't have an epidural, so you're not forced to be on your back and you can move and listen to what your body needs in that time. Of course, your labor is going to decrease. So it's amazing what chiropractic can do, but there's so many things that go into it. And then, of course, we talk a little bit too about after labor and delivery, so in that 4th trimester, there's a lot going on in the body. So postural demands, of course, you're breastfeeding, you're hunched over trying to help baby be in the best position. Baby might not be the best breastfeeder, and so you're really trying everything you can to help your baby while breastfeeding and hurting yourself in the process. You're also doing a lot more lifting. There's more tension, more pain. Your milk supply can decrease. And the thing I didn't mention during all of this in the beginning is you have this hormone called relaxin in your body your entire pregnancy, and it stays in your body even after you give birth. So relaxin is what is responsible for making every joint so loose. You're hearing those things pop and crack that you've never heard pop and crack. And that's really something that, as a chiropractor, I'm always trying to get on top of the relaxin, because I can do an adjustment, but you still have more relaxin pumping into your system. So it's not a one adjustment fix. This is definitely something that is part of the entire pregnancy process and planning for being pregnant and your delivery. But relaxin does help you grow and helps baby form. So it does affect those ligaments after. So getting adjusted after your birth is also very important. And then there's some studies that show postpartum depression can decrease as well if you get adjusted while you're pregnant. So again, amazing things that happen. And it doesn't end there, because infants need chiropractic too. So I talk so much about this in my office. I love seeing babies. And this little girl is Miss Jessica's daughter. This is London. And Jess has a really amazing story that she's going to share with you. But a little bit about infants and chiropractic is birth is traumatic. So even if you have the most natural childbirth and you don't have any interventions and you do everything right, it's still very traumatic for a baby and for mom. So there's so many things that happen when a baby's born and within their first few months, within their first year especially, that chiropractic can really, really help with. Their whole goal for that first year of life is to be upright. So babies are born in that fetal position. They only have one curve, and that whole goal of their first year of life is to get 2 secondary curves that go the opposite direction. So that's in and of itself a huge thing for babies. They have so much tension because of that, because yes, we know they need to be developing those curves to be upright and to hold their head high. And still, though, we're putting babies in car seats all the time, swaddle them all the time, and that's impeding their progress. So doing chiropractic care can really help do the opposite and help encourage that motion, encourage those curves. Because of that, motion is everything. So it can help kids reach their milestones on time by integrating their primitive reflexes on time, which is a huge thing. And getting adjusted when you're little does help your brain develop, and your brain's the synapses create, and your hemispheres kind of link together too. So it's super important. Those first 2 years of life, a baby's brain is growing by 200%. And things that are present at age 7 can become really chronic. So I'll have patients all the time, or pregnant moms say, oh, I have a chronic hip problem. Well, it didn't start 2 years ago. It started when you were probably much younger and had no idea. And then another really cool stat, because I love numbers, is that children fall 13,000 times by age 10. So, there's so many things that parents say, well, does my kid really need adjusted? Yes, they do. They also experience stress, whether it's chemical, physical, or emotional. There's lots of stress in their lives. Again, stress is the biggest thing. And so anyone who's pregnant now and is worrying about delivering or testing positive for COVID, or their husband being in the delivery room, all of that stress is playing such a huge role on baby too. So just trying to learn more about chiropractic and to really delve into how much it can help and what it can do in your life is really important. Getting rid of that stress right now during pregnancy, or if you're trying to get pregnant, is equally as important as then the stress during your actual labor. So I'm going to turn it over to Jess, and you can kind of hear a little bit about your pregnancy if you'd like.
Yes, absolutely. Thank you so much for having me. I just adore Dr. Jordan, and anyone who is blessed to be her patient is just super, super blessed. We are obsessed with Dr. Jordan, and she's played a really, really big role in my life and my daughter's life. So I'm honored to get to share my story for a few minutes. So my name is Jessica Gunn. I've been a patient of Jordan's. I was thinking of this today. Has it been like 3 years now?
Almost 4, yeah.
Wow, that's crazy. Time flies. But anyways, and she has helped me tremendously. So a little bit about me. When I was about 8 or 9, I was diagnosed with pretty severe scoliosis. And pretty much lived in chronic pain my whole life. Had never heard of the chiropractor. That was not like a term that I had heard growing up. My parents never took me, or that just wasn't a thing. Anyways, and so I really just dealt with this pain my whole life and didn't have, sorry for the noise if you guys hear that. There's neighbors like doing four-wheelers of all time. Yeah. But anyways, it was just something that I was used to. Pain was just a part of my life. That was just like a normal everyday thing for me. And then I got married and, my pain didn't go away. And my husband would always be like, you should go to the chiropractor. And I was like, I don't know, that seems weird. And I kind of built it up in my head to be something like scary, which is totally not. And so I was having all these issues and, I would literally be bedridden from my pain and my husband would have to help me go to the bathroom. I mean, that's how severe of a case. Jordan might attest to that, that I am. And, so finally one of these like episodes where I couldn't even like go to the bathroom by myself, my husband's like, you are going to find a chiropractor. Like, we're going to try this. I was like, fine. So I went, and that's when honestly my life was changed. And I don't say that lightly. I think sometimes when you talk about things like, oh, that changed my life, but like chiropractic care, like actually really changed my life. And so fast forward, we had been married for about 8 years and we decided that we wanted to start trying for a baby. But we had concerns. We were really, really worried about, my back issues and would my pain, get worse because, pregnancy is obviously kind of hard on your body. And so we were worried, but obviously ready to start. So, we started trying and we got pregnant very quickly. Not to sound weird, but we tried like twice. And I attribute that to chiropractic care. I really, really do. I had been seeing Dr. Jordan for a while before I even started trying. And I think that played a key role, definitely. So we got pregnant really quickly. And I saw Dr. Jordan my whole pregnancy, every other week until I hit 20 weeks. And then when I hit 20 weeks, I came every single week. And bless her heart, she would spend so much time like pouring her heart and soul into my adjustments and maneuvering and stretching and just, oh my gosh, she made me feel like literally so, so good. And I can say this with pure confidence. And like, I'm telling you, I had zero pain in pregnancy. I mean, of course, you have little aches and minor things, but as far as my back, like it was incredible. I was so, so shocked at how vibrant I was in my pregnancy. I had a healthy pregnancy. I walked every day. Okay, not every day, but close. I was like cooking dinner like up until right before I had my daughter London. I just had the best pregnancy, and I know it's chiropractic care. Like I know that it was chiropractic care, and I can't imagine not having it. So if you are sitting there pregnant, or even not pregnant yet, and you're thinking like, I wondered if I would want to do this when I'm pregnant. Do it. It's worth every single penny. You will never regret making this investment. It's a small, small investment for what you get. To live, have a healthy pregnancy, and to not be in pain, and to have all these benefits given to your child in utero at the same time. It's priceless. You can't put a price on that. So if you're considering the cost, don't. I really can't. I don't know. Do you want to interject anything?
No, I think you can jump into your actual delivery if you want. I do want to say that because I was her chiropractor, I was the first person to know she was pregnant, which has been probably the highlight of my job. It's amazing to adjust babies every day and hear amazing stories, and babies are able to breastfeed after not being able to, and babies are able to have a bowel movement after not for 10 days. That's all great, but there's been a few patients now where I've been the first person to find out they're pregnant, and that has definitely been my favorite part of my job, I would say.
I'll never forget texting you to tell you. And I totally played it off to my husband because he was like, we're not telling anyone for 12 weeks, not even, nobody. And I was like, okay, I'll honor that. But I was like, but I have to tell Dr. Jordan because she's my doctor. And she's really my really good friend too, but I'm just using this.
Yeah.
So yeah, you were the very first friend in person that we told. So that's really exciting. So I had an amazing pregnancy. It was really pretty textbook, no issues, nothing. Again, I attribute that to chiropractic care. And so through a series of the events, I did end up having a C-section, but it was actually a miracle that I ended up having a C-section because when the doctors opened me up, they found that I have half a uterus and one fallopian tube. So it's actually a genetic condition called a unicornate uterus. So I'm actually a unicorn, guys. I literally carried an almost 9-pound baby past full term with half a uterus. And I don't you have to like say those words again, I think, to like really process like how huge that is. The doctors were absolutely amazed. They were like, what did you do? They literally were like shocked. And they said, had they known that I had half a uterus, they would have labeled me as high risk. They would have put me on 100% bed rest from 20 weeks on. I would have had to have had weekly ultrasounds, like all these horrible, stressful things. And I didn't have to have any of that. I was so healthy and, just like able to enjoy my pregnancy, and they were shocked. They were literally, of course, I was like out of it, so I didn't know this, but my husband saw, they were calling doctors and nurses in to like come and take pictures of my uterus, which is kind of weird, because it's so rare. And the fact that London, my daughter, was almost 9 pounds and I carried her past full term, it's really a miracle, but it's chiropractic care. Do you want to interject anything, Jordan?
No, I was just going to say, if you look up the stats of having a unicorn uterus, it's not very good. It's not like a pretty picture. There's a lot of issues and numbers that you can look at, but getting pregnant is harder. Sustaining a pregnancy is harder. Going past 30 weeks is pretty shocking. Having an early pregnancy is very, very, very common. So that just goes to show, and I hope you don't mind me saying this, but you're like 5 foot.
Yeah, so, I'm like a little shrimp.
Yeah. You're not someone who's 6 foot tall, that's all belly and babies.
Well, I have a really short torso too. She did not have much room in there.
Yeah. So all those kind of things stacked against you, someone carrying a 9-pound baby anyway with a healthy, pain-free pregnancy is amazing. But knowing all that we know now, and then how quickly you were able to get pregnant, and the fact that she was 40 weeks and some odd days, it's really crazy and amazing.
Yeah, and I want to kind of reiterate, I think I touched on this briefly, but it was so much more than just an adjustment. Like the maneuvers that you were doing, the stretching, literally you were creating more room for London, and it makes me cry like every time I think of it, because, oh gosh, I didn't plan this, guys. It just makes me cry because I'm just so thankful, because I'm like, what if I hadn't done chiropractic care? Like, I can hear my husband putting my daughter to bed right now, guys. Like, it matters, but you would just spend so much time like adjusting and making room for London. And I know that's why she stayed in as long as she did. And so I'm just very, very grateful. And and like you said too, we got pregnant so quickly too. And if you look at the statistics, like, it's very hard to get pregnant with this condition. I have 1 fallopian tube, so right there is like your chances are like cut pretty significantly. And so, I'm just grateful. Sorry, I didn't mean to start crying.
No, I know, you're making me tear up too. Okay, do you want to just touch briefly? I kind of touched on infant care a little bit with chiropractic, but just some of the biggest things you've seen, because London's been a patient since her
She's 3 days old.
Yeah. Oh, yeah. Nice. Yeah.
Yeah, I think she was literally 3 days old.
Yeah.
That was her first adjustment. We have the cutest pictures of you adjusting her and stuff. I remember that. But you guys, like, London is the healthiest little girl ever. Like, never sick. She's never had an ear infection. She's never had literally, I can't even think of, like, she's been sick like one time for 48 hours, like some little fluke thing. She's never sick. She's almost 2.5 years old. And you hear about kids all the time. And I don't say that in judgment, and there's other factors obviously too, but you hear about all these, kids are sick all the time, constantly, like chronically sick. And so I'm convinced that chiropractic care, since she was born, we've never missed an appointment. She's gone every other week since she was 3 days old. We've missed an appointment. Jordan's probably like, no, I'm kidding. But just that consistency, she is so healthy. She's so smart. Okay, this is where I'm going to start bragging on my child. But she really is just a brilliant, bright little girl. And there have been weeks that are harder than others in momland, right? And I'm telling you, after we go to the chiropractor, she calms down. She's not psycho anymore. Toddlers are kind of crazy sometimes. Just her mood shifts. There are times where I'm we get there and I'm here, please hurry, adjust her, because toddlers are crazy and they have a lot of things going on in there, and so that's just been really huge for us. Constipation, Let's talk about that.
I was going to that picture of the screenshot of the picture of her with it up the back, and I was like, I'll just ask Jess to talk about it.
Yeah,
we
have an inside joke. It's called the after Chiro poo, because it's like clockwork. Like within an hour, she's having like massive blowout, because that's, I mean, what chiropractic does, cleans them out, gets everything aligned and working properly and functioning right. So there have been times where I'm like, oh, she needs you. And sure enough, I mean, it was not very fun when she was little, but now she's potty trained. So, but yeah, I mean, the benefits go on and on and on. And I know Jordan touched on some of that, but, as a family, I mean, now my husband sees Jordan as well. It's a family affair. Although you've never adjusted our cat.
Not yet, but I can. I did one today.
You can do it all. But it's just a really big part of our family, and an absolute gift. And I'm just like, I just beg you, if you're considering it at all, and you don't want to make the investment, I just want to say you will never regret it. You just can't put a price tag on that, because you don't know. I had no clue. I had no clue that I actually really, really needed chiropractic care outside of my issues and my pain. My daughter's safety was on the line. Like, you just don't know. You don't know what's going on in your body. You don't know what could be, happening. So I say, do it.
Awesome.
Yeah.
Thank you very much, Jess.
You're welcome.
All right. And so with that, I am going to show you guys our offer tonight. So if you want to call the office, and that's little London, she is really very cute. If you want to call the office and sign up, and you're interested in what chiropractic care can do during your pregnancy, before you get pregnant, or if you have recently given birth, really anything, we are here to help. So if you will call the office and tell them you watch this webinar, you get about a half off discount, and that's going to include your scans, reported findings, and your first adjustment if you're pregnant. And those scans, I didn't really touch on these, but these are a really good way that we can have a direct insight on that nervous system and see how your body's functioning, how much tension is in your spine. The variation of your heart rate can tell us a lot about stress. It's just a really good picture for us to have, and then as well as to monitor. So we are always redoing scans, redoing our reports to see how best we can serve our patients. But that $125 does include your scans, report, and your first adjustment if you're pregnant. And that's like the selling factor, because most pregnant moms leave their first adjustment already kind of sold. Like, they stand up and they're like, oh my gosh, one, I got to lay on my belly, which we have a table that's specially for that. But two, they stand up and they're like, oh my gosh, I can breathe. Like, the pain on my ribs is gone, or I can feel the baby moving so much. And that pubic bone pain, pubic symphysis pain, can't feel it at all. That's amazing. So the adjustment in and of itself kind of helps with your decision, but that is all included in that price. So if you want to call our office, you can talk to Ms. Jen this week and get scheduled for that. And thank you guys so much for listening. I really hope that this was informative for you, but also kind of inspiring and lifting hearing Jess's story. So without further ado, thank you guys. And I hopefully will see you in the office soon. Have a great night.